I was wearing sandals. I was on my hands and knees, right in that area.
These are the words of a Windsor resident, shocked when she found a fully loaded needle on her lawn while she was preparing to cut her grass. Windsor police admit this is not an issue isolated to the downtown core, and it must be addressed not only by the police, but requires a community-based response. This is one of many alarming news lines appearing all across Canada. In Canada, there are approximately 50,000 to 100,000 injection drug users, and studies show that the average user will use over 1,000 needles per year. This means there are up to 100 million used needles that could be discarded each year on the streets, on school grounds, or even in your own backyard. While these numbers are alarming enough, the opioid crisis in Canada is rapidly growing. Past responses to address this issue were focused on criminalization, policy creation, and prescribing restrictions. However, this has shown to be unsuccessful. More recently, Canadian communities have developed harm reduction programs. These are initiatives acknowledging legal and illegal drug use within the community, but focus on minimizing its negative effects. Canada's first attempt at a harm reduction program for opioid use was the implementation of a needle exchange program located in Vancouver in 2003. This program allows drug users to have a safe place to inject with clean needles, medical monitoring to prevent overdose or other complications, ensures proper disposal of used needles, and even offers a rehabilitation program to motivated users. Needle exchange programs also provide a sense of community and support system to those suffering from addiction. This new approach has been shown to be effective in reducing poor outcomes related to drug use. Although this was definitely a step in the right direction, and similar models have been created in many other urban areas of Canada, these sites remain inaccessible to many Canadian communities, especially in rural areas. Due to distance being an important barrier, users are more likely to reuse or share needles and are less likely to dispose of used needles safely. Unsupervised, it is also more likely that users suffer health emergencies. Another barrier to the implementation of harm reduction programs accessible to all is a lack of public education leading to stigma. Many people in society do not see the value of these centers in their communities. Stakeholders include harm reduction programs, health units, and the entire community. So far, key stakeholders have worked towards creating these facilities and improving the Controlled Drug and Substance Act through lobbying. To increase accessibility to these resources, nurses can continue to lobby for change, develop research based on the topic of harm reduction programs in rural areas, advocate for safe injection sites or needle exchange programs in remote areas, and educate the community to reduce stigma. Effective harm reduction programs can reduce healthcare costs by decreasing infection rates, overdose incidents, and needle stick injuries. Emergency department wait times would decrease, and fewer admissions due to overdose or other drug use complications would be necessary. With continued efforts to improve harm reduction programs and make them accessible to all Canadians, it is hopeful that headlines such as those shown at the beginning of this video will no longer be a regular occurrence.